Hypertension in pregnancy, or preeclampsia. Preeclampsia is a condition that can develop during pregnancy characterized by high blood pressure or hypertension and protein in the urine or proteinuria. Preeclampsia was formerly known as toxemia of pregnancy. Preeclampsia occurs after the 28th week of pregnancy and can even occur in the days following birth. Preeclampsia and eclampsia are most common in first-time pregnancies. Pregnant teens and women over 40 are also at increased risk. The symptoms of preeclampsia: presence of protein in the urine, elevated blood pressure, sudden weight gain, swelling of feet, legs, and hands, severe dizziness, headache, fluid in the lungs, and nausea. Causes of preeclampsia: age-related disorder of the lining of blood vessels, commonly for teenagers from 14 to 18 years old and late pregnancies over 40 years old. Abnormalities of the placenta. Pregnancies from egg donation or donor insemination. History of preeclampsia in the family. Obesity. Multiple gestation, and having diseases like diabetes, lupus, or kidney trouble. Diagnosing preeclampsia: urinalysis, blood tests on blood count and blood clotting possibility, blood pressure monitoring, and routine prenatal checkups.
Treatments of preeclampsia. There are no cures other than the delivery of the baby through induction of labor on the 37th week of pregnancy or cesarean delivery on the 34th week of pregnancy if severe preeclampsia occurs. The administration of intravenous magnesium sulfate, lorazepam, and phenytoin to prevent eclampsia or seizures. The intake of hydralazine to lower blood pressure. Complications that accompany preeclampsia: low birth weight and delayed fetal growth, preterm delivery, oligohydramnose, a decrease in the amount of amniotic fluid, the risk of placental abruption, or the separation of the placenta from the wall of the uterus, and, if severe, life-threatening bleeding and fetal death may occur. Very rare or uncommon complications that may occur: HELP syndrome, which stands for hemolysis, destruction of red blood cells, elevated liver enzymes, and low platelets, is a rare complication of preeclampsia, the decreased blood flow to the brain resulting in a stroke. Prevention of preeclampsia. There is no known way to prevent preeclampsia. However, the outcome may be improved with prompt recognition and management. So it is important for pregnant women to have routine health screenings and checkups. Prognosis of preeclampsia. Women experiencing mild preeclampsia have good pregnancy results. Women with history of severe onsets of preeclampsia have the highest recurrency risks, ranging about 25% to 65% of women. Women with preeclampsia may be at an increased risk of cardiovascular diseases later in life. This concludes our presentation about hypertension in pregnancy, or preeclampsia, the basic facts and treatments. Thank you for watching. I am Justin Candelario.
And I am Naika Acosta.